Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. On the program today, we're going to be talking about a very safe and gentle way to be able to cure some of the ailments, or at least relieve you of some of the ailments that may be affecting you. Perhaps you might have a fever, maybe a toothache, or an aching joint. Well, throughout history, such natural remedies that we're about to talk with today can safely be used at home to bring such relief. And these are things that are valued by herbalists, midlife, and mothers throughout the history for being a gentle yet highly effective way to achieve this. We're going to be talking about the wonderful book that talks about these things, Natural Compresses and Poultices. Our guest joining us on the program has had a naturopathic practice for about 40 years. And alongside with therapeutic work, he organized his own introductory courses to naturopathy and started teaching in various health-oriented associations. I'd like to welcome to the Beyond 50 radio program today our author and guest, Natural Compresses and Poultices, Mr. Christopher Vassy. Dr. Christopher Vassy, thank you for joining us here on the program today.
It's a pleasure. Hello, Danielle.
You know, I was taking a look at this book, and it's amazing how much of it most people may have in their home when it comes to being able to achieve some of the things that you're talking about here today.
Yeah, and that's the good point about it, is that when someone is, as you said, has a painful joint or eczema or headache and so forth, this person does not really necessarily have the remedies to cure himself. There might be no doctors around, but with compresses and poultices, he can cure himself because these compresses and poultices are made with things which are always in every home. I mean, there's always water, there's always cloth, there always cabbages or potatoes which can be used, and that's what makes it so important to know about. It relieves pain and suffering quickly, easily, without danger, and they can also be used, these compresses and poultices, to help someone cure himself of an illness or another. It cannot do everything, but it can contribute.
Well, certainly, I know somebody, as I was mentioning earlier, who might have a toothache, and boy, you know, anybody who's ever had a toothache knows how they want relief until they're able to get to the dentist, in fact, if they can even get to a dentist. But you talk about certain things in there that can relieve pain anywhere from a toothache, you know, right down to, let's say, a tooth abscess, which if anybody's ever had anything like that knows how painful that can be. One of the things I thought about that really came to mind is how we human beings came to discover these things. And I'm sure in your studies and all that, you must have some pretty fascinating stories about that.
Well, as far as we know, since man has been on Earth, he's been using making poultices or compresses. Hippocrates, the Greek doctor, father of medicine, talked about it. All the folk medicine around the world have been using them. And I think it's quite something which is quite instinctual, because when one bumps our knee in the wall or something, we instinctively put our hand on it, or if a kid hits his head, we blow on the bump, or we put a little water to soothe it. So it's something we do, and with time it was more elaborated, and many different ways have been discovered how to use these easy ways of relieving pains. But it's not only human beings, because animals also use them, maybe not in an elaborated way as we do, but when some animals have problem with their legs, for example, they will put their feet in a clay, make a clay poultice. Well, they won't be able to say it's a poultice, but nevertheless they do it. And maybe that's another way man find out how to use them, to make them, by observing what animals do.
Now let's go ahead and talk about what a poultice and a compress is. Is there a difference?
Yes, there are differences. A compress is a piece of cloth that has been soaked in liquids and then folded several times and then placed on the ailing part of the body. And this liquid can be water, it can be infusions of medicine, herbs, vinegar, and so forth. But a poultice is not with cloth, it's a paste-like preparation that is applied directly on the skin or wrapped in a thin cloth before it's put on the skin. And it's made with, it can be ice cubes, clay, cabbage, onions, lemons, potatoes, many different things can be used. So compresses is a cloth with more or less liquid in it, and poultices are paste-like preparations.
Mm-hmm. Now, it was unique to read this because something really came to mind when it comes to healing and the human body is that touch and sensation are pretty important for that process, aren't they?
Yes. When one puts a compress or poultice on the skin, it's like a second skin, but usually it's of a different temperature. And that's part of the effect, the therapeutical effect. Because if it's cold, for example, the poultice is cold, the body will be made cooler, and that can relieve pain if there's an inflammation, for example. But the body cannot tolerate that this cold cools the flesh for too long. So there's a reaction that comes afterwards, a bit later on, which is that the body will make a lot of blood come into the region which is too cold, with the result that very soon this ailing region is full of blood, bringing oxygen, vitamins, healing substances, and so forth, and then can fight the illness. That's the basic action when one uses cold or warm. Well, the warm is the same kind, but the action is direct. If you put warm on the skin, very warm, then it will accelerate all the metabolism in the area, and that helps to relieve the pain and cure the illness. But there are also other effects because there might be medicinal substances in the poultice or antibiotic substances and so forth, and that's also a way which contributes to the therapeutical effect.
Another thing, too, that I found unique was the fact that you also talk about clay. Now, what kind of clay are we talking about there, and how is that effectively used?
Well, the clay I'm talking about is the clay you can find in the countryside, but usually one buys it in a shop, but one has to be careful that it's clay for healing, not for making pottery, because then they add additives which we don't want to. So usually it's in the form of a powder, and one mixes it with water to obtain a paste which is sufficiently solid to stay where we put it. And this poultice can be at the beginning half an inch thick, and then next or 1 inch or 2 inch it can increase with time. And by when this poultice of clay is on the skin, it will start to dry, of course. And when it dries, it draws up the toxins and the toxics which are in the ailing part of the body. That's why if someone has a knee which is very full of pain, we can put a clay poultice on it. It will pull out the toxins which irritate, attack, inflame, and trigger the pain in the joints. And by pulling them up, it will leave the patient. And of course, when it will last maybe 1 or 2 hours, it will be effective 1 or 2 hours, because then it's totally dry and doesn't draw any toxins up anymore. So one replaces this first poultice by a second one, and so forth, and progressively we can liberate the joint of all the toxins. Well, progressively, it takes time, but it's a way of relieving and then curing.
Now, I know one thing that people seem to be afflicted with quite a bit is headaches. And I'm kind of curious, is there a way, or have these been effective for people to get pain relief from headaches versus taking aspirin?
Yes, there is the different ways. Well, when someone has a headache, the blood circulation is not good in the head for different reasons, and the head can be congested, and that's what causes the pain. So what we want to do is stimulate the blood circulation in the head. So we can use compressors which are cold or warm. It's difficult to say which one will be the more effective for a specific person. One has to try. But this compress is a piece of cloth which is soaked in very cold water, and then it is put on the forehead, and this cold will then stimulate the blood circulation in the head. And this compress is left at its place until it becomes warm or lukewarm, and then it's not effective anymore, so one replaces it with another compress with cold water in it, and so forth. This is one way of doing it. It's also possible to put it on the nape of the neck, same process on the nape of the neck. Now, I've talked about cold. Another possibility is to make the compress warm. So the cloth is put in hot water and then put on the nape of the neck or the forehead, same process. And many people are very happy with that. They don't have to take aspirin or anything else, and it will relieve them. It will not cure them definitively, of course, but because usually the cause of headaches is somewhere else, very often in relation with the liver.
It's pretty amazing to think just how simple a lot of this is and being able to apply. Now, when you were talking about poultices, you were talking, as I was reading in the book, about these are things in form of a paste. So are these things that you actually prepare as well?
Yes, like I said about clay, it's a powder, and you mix it with water to obtain a sort of paste-like substance, which then you can put on the skin. But if it's done with potatoes, for example, one cooks potatoes and then mash them, and then one lays them on the part to heal. And that's the potato that have no therapeutical effect. It's just that they are a support to warmth. It keeps the part of the body warm, accelerate the blood circulation and the defensive processes. So that it's a paste. Yeah, it's by opposition to a cloth which is full of water, as compressors are.
Oh. Now, I was curious about, I know not too long ago I had a sore throat. Now, how about that, Steve? Anybody who's ever had that knows it's kind of funny how once you get one, you always seem the need to swallow.
Yes. Yeah. Well, that can be also cured with different poultices. One way of doing, which is a bit strange but very effective, is to take onions, to cut them in small bits, and then to fry them very slightly so that they become warm, because a part of the effect, therapeutical effect, is the warmth, but also soft, so that we can apply them easily on the throat, the region of the throat. And the effect is as follows. It's warm. It's a warm poultice, so it will accelerate the blood circulation in that area, and the blood, which circulates more quickly, will take the toxins, microbes further away from the throat, which is already a relief. But also the onions have antibiotic substances and also anti-inflammatory substances, which traverse the skin and enter the region of the throat. And that can relieve the person a lot. This poultice must be then, after 5 or 10 minutes, it must be replaced by another one, and so forth, so that the effect is more intense, profound. Yeah. Another way, as you're always speaking on radio, you might need two different ways of curing yourself. Another way of doing it is to take a lemon and to cut it in slices, and then with the bottle to make the slice more supple, soft, and then to apply those slices of lemon on the region of the throat, so maybe 2 on each side, and they're not warm, so warmth doesn't act at all. It's a question of the substances, the antibiotic substances which are in the lemon, which come into the throat region and help to fight the infection.
Now, here's a big one, too. How about back pain? Now, a lot of people usually have back pain more often as a result from long periods of standing, perhaps not the right kind of shoes, all the way down to the fact of how they actually sit in a chair. So what do you say to that?
Yeah, well, here the region is stiff, not well irrigated, inflamed, painful, and what usually works the best is to bring warmth. And on a support with something which can be keep warmth for a certain time. And the easiest way and cheapest way of doing it is with potatoes, as I described further just before. Cooking potatoes, mashing them, having mashed potatoes, and then putting them on the area a bit more than the ailing area, and then with maybe 1 or 2 inches of potatoes, and that's very warm. The person must, of course, lie on his stomach, and then just bring a lot of warmth to the region. Therefore, the blood vessel will dilate and therefore increase in size, so there will be more blood called to that region, and the whole process of curing can help. Usually it's warm poultices which work the best. Sometimes with some people, but it's difficult to know beforehand, cold poultices would be more effective.
Now, you also bring up things such as vinegar. Now, how come vinegar can be effective in this kind of treatment?
Well, vinegar is a substance which is a bit, let's say, irritating. It has a repulsion action. That is, it will attack this. Well, when you put water, it's usually put with a mixture with a little water and put into a compress, and that the vinegar will attack very slightly the skin, but nevertheless it attacks it, and the skin is annoyed, so it will react and try to defend itself by bringing more blood into the skin region. And that vinegar, to make it simple, intensify the reaction of the area where the compress is put. And this vinegar is very much used when someone has a fever. Have you heard about vinegar slippers? It's a cold compress, cold water mixed with vinegar, 50% of each. And you soak a piece of cloth in this mixture, and then you wrap your calves with it, both calves. And this is very good for people who have fever, when you want to lower the fever of someone, because the cold will take warmth out of the body. The cold will also trigger a reaction in that area, plus the vinegar, which triggers also the reaction. A lot of blood comes to this region is cooled, made colder because of the cold compress, and this can lower the fever for a certain time. It will last maybe for half an hour, and then one has to put another of those vinegar slippers. It's very effective, especially for children. So children with fever, I mean.
Gotcha. Yeah. Absolutely. It's pretty amazing to think about the simplicity of all this now and the gentleness as well. Were there any surprises as you were looking up the history of this and applying, the knowledge and so forth that came to mind that people listening today might feel or seem that it was unexpected?
Well, what surprised me was that what we use nowadays was also used a long time ago. Hippocrates, for example, it was 3 centuries before Christ. They were using the same kind of things. It's common knowledge, I was going to say. It should be common knowledge for everyone nowadays, but it's true that many people, they prefer just to take a pill, or they're not aware that there are those simple, effective ways to relieve pain and cure themselves of small ailments. And, well, that's why I wrote the book, to help people become aware of it. And some people might think it's a bit difficult to organize oneself and do those compresses and poultices. But I explain there's a whole list of illnesses and how to treat them. And for each of these illnesses, I give 2 or 3 examples of appropriate compresses of poultices. And I give the necessary material they have to fetch, and then how to prepare it, which temperature, cold or warm, must be the compress, how to apply it, for how long, how often one has to change it. Everything is written precisely so the person can, it's an introduction to the subject and the practice of doing compresses and poultices. And I would suggest that people would start trying one and then another, because it's, as we know, it's with experience that one feels better how to do it in the correct manner.
Now, one thing we haven't talked about that was kind of unique and surprising is that of using cabbage.
Yes,
yeah, we think of cabbage and coleslaw, but we certainly don't think of it as a compress or a poultice. Well,
no, that's true.
What is it about cabbage? Well, what's going on here?
Well, I don't know who discovered it, but it's something which everybody can observe. Putting cabbage leaves on the ailing part of the body is very effective. Of course, one has to cut out the big the stem, the stalk, so that it's quite flat. One has to prepare those leaves, several leaves, by rolling them with a bottle, for example, to smooth them, make them more supple, so that they stick well, they are well against the skin. And by putting several layers and then tying it all up with a piece of cloth or something, then and letting it just rest. Nobody has really been able to explain how it works, because it's not cold, it's not warm, it's not substances, but this kind of poultice draws the toxins out of the flesh, which is just underneath the skin to begin with, and then the flesh, which is underneath. And this is not just words, because when such a poultice has been on the part of a body for half an hour, for example, it can be so full of toxins that it looks as if it's rotten or cooked. And it smells very badly because it's full of toxins. And that's why such poultices are let on the skin for half an hour, and then it's full of toxin. One throws it away and put new leaves on the same area so that they can draw more toxins out. And this drawing of toxin takes place first at the surface in the skin, but then in the lower layers of the body and deeper. So even that organs which are quite deep in the body can be helped through poultices which are put on the surface of the body.
You know, this is all really enjoyable to talk about because, again, like I was saying, you know, the simplicity, the fact that these are time-honored, you know, they've been around for a lot of years. It isn't just something somebody made up one day and people are hoping that it works, but it seems to work pretty consistently with people from everywhere. And, again, the book is Natural Compresses and Poultices. And what would you say, starting forward today for the listeners out there, what are some common items that they can be sure to have, maybe make a little short list there of what you have here in your book that they should have on hand, you know, for a regular basis, just in case?
Well, the first thing for compresses, they need pieces of cloth, which can be cotton, that's natural, it's good, or linen or wool. But cotton is very good, so it can be a kitchen cloth or a towel in the bathroom or an old piece of sheet or things like that. And then they can cut it, when the time comes, they can cut it at the correct dimension to make a compress. And then, cabbages is good to eat, so if they have cabbages, fine, that's good to have. It works for many, many things. And probably everybody has potatoes too, onions, lemons, ice cubes. Most people who have a fridge will have ice cubes, which are very effective because they bring a lot of colds to the body, and the body has to react a lot. It's a wonderful way to calm inflammations or pains. It has an anesthetic effect. So, I would say closses, that would be the best thing to have. And clay. You've got to buy clay. It's better to buy clay for health purposes. Yeah.
Very good. Now, I know people find a lot of great information, how they can get your books, their CDs, videos, articles, things like that, and they can find that at christophervassi.ch. Is that correct?
Yes, that's my website address, Christopher Vassi in one word, and then .ch. And on the website, I present my books. There's the table of contents, a picture, a summary, articles related to the subject of the book. And there are also other articles of general interest, videos, a few books to download freely. It's free to download. There are many things to discover.
So we got a lot you can get started with, and certainly kind of get your list there. I was just thinking of something, and that is when we were talking about cabbage. And a person might decide, I'm going to make my own sauerkraut at home. Now, we've done shows here. One of them we actually talked about when everybody was concerned about something like the avian flu or something like that. And they said, one of the best ways to actually protect yourself from even getting in the first place is just eat a tablespoon of sauerkraut each day. And I thought, really? And they explained why. So I thought, in light of what you have here with your book, why not make a sauerkraut compress? Because then you get the best of the cabbage leaves as well as the vinegar.
Yes, it would also work. It's I mentioned different things, but as you said, we can do it with choucroute, and then we can find many other things which to use, which can be useful. Yeah.
So you can experiment with this, and there's really no terrible side effects to think of, right?
No. But I think
that maybe the pain might not go away.
But first, I think the person must learn how compressors and poultices really work, the general actions and properties of them, and then he can invent and discover or research other ways of doing it. But the basic rules must be learned at the beginning, that cold has this kind of effect and warm has this effect and so forth.
Absolutely. Well, Dr. Vassi, I want to thank you for joining us here on the program today. Again, the book is Natural Compresses and Poultices, Safe and Simple Folk Medicine Treatments for 70 Common Conditions. Again, thank you for being on the program today.
Yeah, thank you. It was a pleasure.
You bet. We want to thank you, the listeners out there, for joining us. You can discover more at beyond50radio.com. That is the number 50. We do encourage you to sign up for our weekly e-newsletter and keep up to date with what's going on in the world of Beyond 50 as well as our upcoming programs. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 radio program. And remember, live your day past halfway.